This presentation was created by She's the First to discuss the impacts of COVID-19 on girls across the globe. COVID-19 leaves many questions unanswered. How long will this pandemic last? How will the global economy recover? When, if ever, will life go back to normal? There's so much we don't know. But there is one answer we do know, without a doubt, and yet you aren't hearing about it in your news alerts. We know COVID-19 will be brutal for girls. Before COVID-19, there were already 130 million girls out of school around the world. More than 650 million women and girls in the world today have been forced into child marriage. That's one girl who becomes a child bride every 7 seconds. Globally, right now, there are more than 15 million teenage girls who have reported experiencing forced sex, and we know that number to be low, based on some countries missing data and noted underreporting of sex crimes. This is the reality for girls prior to this pandemic. We also know that because of COVID-19, these numbers are going to skyrocket. With heightened tensions and financial stress at home due to this outbreak, girls are more likely to experience domestic abuse and violence at home. With schools and programs closing in response to the threat, they're more alone than ever. Meanwhile, clinic workers and funds for reproductive health are diverted to fight the virus, leaving girls with even fewer resources. With all of these changes, girls are more likely to suffer higher rates of unwanted sex, transactional sex, and teenage pregnancy. We even have a case study on this. During the 2014 to 2016 Ebola crisis in West Africa, governments closed schools and forbade public gatherings. They also diverted funds and clinic workers from reproductive health and girls programs to instead fight the virus directly. The result? Well, at the start of the crisis, more than a quarter of girls in Sierra Leone were pregnant. But with the Ebola crisis raging, those rates increased by 65%. Foreign Policy reported on the outbreak of rape that took place during the epidemic, as girls were kept behind closed doors amid heightened financial and domestic tension. Children reported an almost universal uptick in both child labor as well as violence within the home. We know what happens to girls during a global pandemic. We've seen it. We have the evidence. So we know that girls will suffer if we don't intervene. We know that child marriage rates will increase. We know that teenage pregnancy rates will increase, and we know that there will be violence against girls. We need to prioritize their needs, and we can't wait. So how can we do this? Luckily, we have one set of actors well positioned to work with and for girls in their efforts: community-based organizations. Organizations are responding to the current crisis, and they're best positioned to do so. These local community-based organizations already reach the remote communities where girls live. And so while they do have to close their schools and programs, they're able to activate their existing networks to reach people who are most marginalized. In Tanzania, the organization GLAMI has created a toll-free line for girls to call when in trouble, and mentors are working with girls via phone to continue the mentorship programs that the health crisis interrupted. Starfish International, a girls' empowerment program in the Gambia, is creating videos for their staff and girls to share widely on social media, while also creating masks and soap for community use. Community organizations recognize that not only do we need to protect girls during these crises, but that girls can also be one of our greatest assets. In Guatemala, the organization Maya has already begun enlisting their students as frontline community educators. The girls use videos and translate health tips into local languages for everyone to understand. Local organizations and the girls they work with are positioned well to fill an information gap that would otherwise contribute to unknowable numbers of preventable deaths. Girls carry with them the key to a brighter world, but only if we can ensure their safety. You can find a list of additional resources and action items on our website at she'sthefirst.org/COVID. Stay safe and stand up for girls. They need you now more than ever.